Double check that we are okay. Wait a second, Martin. Hi, how are you, everybody? I'm trying to put together our live today, and I'm calling my son so that he can help us here because I'm having a situation with the live in Instagram. Wonderful, and he's not here with us. So let's wait some seconds. Sorry for everybody for my delay. Invito a todos a transmitir contigo. So I don't want this to happen. So hi, we're gonna talk today. Martín, ¿me puedes ayudar? We're gonna talk today in Spanish. Sorry, in English, but I cannot do this. It's not working. It's not working. I don't know why. It's not working. Okay, so I'm gonna start talking today. We're gonna talk in English. Remember that we're doing a live.
Si hay gente aquí.
Okay, it's there. I don't know what's happening.
I don't know either. It's like trying to teach you it.
Okay, so get out of it.
How to skip this tutorial.
Okay, okay. Thank you very much, everybody. Now we made it. So thank you, everybody. I was trying to put my Instagram together, and now we're ready. Thank you for waiting for me. I'm looking forward for this live today, and we're gonna talk about makeover. That is a big, let's say, a big theme, a big subject to talk about. Right now, I'm in the USA. I'm in the graduation days of my son. My oldest son has graduated from college. We're very happy about it, and especially because he's very passionate about what he's doing. He graduated from, it's called game design. And again, we're very happy here in the US for these days. I will be back actually Friday, already working again in Cali, Colombia. Remember, I work in Cali, Colombia. So again, we're doing this live today in English because many of you have asked us to do these lives in English. So we're gonna talk about the mommy makeover. And as I said, usually when let's say we are younger and we are like focused on our hobbies, focus on our jobs, then we find our couple, we decide to have a life together with this couple, and many of us decide the challenge of having kids, right? So we get pregnant, we have our kids, and guess what? After we have the kids, sometimes comes one, then comes the second one, and we're so busy with the kids and still we don't want to lose our job, so we want to keep on growing and let's say, and climbing that ladder in our job. So we work hard, we have the kids, and we sometimes forget a little bit about us, and just in that taking care of kids, taking care of the house, taking care of our jobs, and we just kind of forget about that a little bit. But suddenly something stops and we look back on the mirror and say, oh my God, I just want to feel like I felt before. Like I felt before of this life that I'm living now, where I don't have a minute for me. And many times after we realize that, then we start seeking different aesthetic procedures for looking good again or feeling good about ourselves. That doesn't mean that everybody that has kids needs to have aesthetic plastic surgery procedures or aesthetic procedures. That's not true. But usually it's this time in life when, for example, everything comes together. I mean, many times we have the kids, then we look at the mirror, and many times we start to notice wrinkles that we didn't notice before. We don't like that, so that's why we start with the non-surgicals many times. And also, of course, our body is not the same as it was before. It's not the same as it was before we having kids. So usually when we have pregnancies, what happens? Of course, our breasts enlarge and then they come back down again. And that makes some physiological changes in our breasts. And of course, breastfeeding, that many women love the sensation and the bond that is established with the baby and the breastfeeding. If I need to be truth, I didn't like that breastfeeding. I did the breastfeeding because if not, my husband will not be happy with me. So, okay, I did that like, okay, that's my job. I have to breastfeed the kid. But as soon as I was able to don't breastfeed anymore, I just didn't do it anymore. I know many patients see that's magical times, but I didn't felt like that magical times. Actually, I never bought anything to extract my milk. When I went to the shops and I saw that, I said, oh my God, never in my life I'm gonna buy one thing of those. No, I feel like a cow, no. And I know many of you must be saying, she's crazy. Breastfeeding was the best times of my life. And I'm happy for all of you that felt that, but that's not the case of Lina Triana. I didn't like it at all. And I produced a lot of milk, believe me, but well. So again, our breasts enlarge with the breastfeeding. And then, of course, they deflate. And when this happens, guess what? The skin get loose. And if the skin get loose and we also may lose a little bit of breast tissue, we end up with breasts that are a little bit not as nice as they were before, a little bit hanging, and we want to lift them up back again. Yes. So one of the main mummy makeover procedures is a very popular one is what? Well, a breast lift. And here there are different options because when we're talking about a breast lift, we can do just implants. Breast implants can be an option because many of us doesn't have them so much like grouping, like drooping. Some just they deflate on the upper pole, and we don't like that, right? So because that's why bras were discovered. So that we have an upper pole that looks like nice, right? Like with a cleavage, because we like cleavage. That's what makes us different from men, right? So when that happens, but there's a cleavage, we're happy. It looks nice, a cleavage. And many times with pregnancies, it deflates. And when it deflates, it can be when we put an implant back in, it will give us also a nice cleavage again. And maybe we don't need a breast lift because if we're talking about a breast lift itself, it means that the breast has fallen and we need usually to take skin out. And if we need to take skin out, guess what? We need scars. And many times we women don't like scars. So again, if it's a little bit of deflation on the upper pole, you can go ahead and use a breast implant and then that will help me with a better appearance of my breast. Of course, if there's a lot of skin, loose skin, we can do a breast lift. That breast lift can be done without implants. We don't need the implants, but of course, many patients would prefer the implants when they have lost breast tissue or when they want this cleavage to be a little bit harder and rounder, especially in Latin America, a lot of patients like that. So we can add to the breast lift a breast implant. Again, since every patient is unique, it's important when you speak with your doctor to bring into consideration all the options so that you decide what is the best option for you right now, meaning just an implant or just a lift. And what about the scars? If it's around my areola nipple complex, or it's like a lollipop around the areola and a vertical, or it's a T, or it's an L, depending on what technique is going to be used and how much skin it's how much excess skin is present, and of course if we're going to add an implant or not. Many times we think that if we add an implant we will not have scars, but again, if we have a lot of loose skin, we will still need some scars if we put an implant. Again, every patient is different, so that's why it's so important for you to speak with your doctor and together decide what is your best option. So that's it. We talk about mummy makeover regarding the breast. Also, although I cannot talk about everything here, it's just a little bit superficial, and we will make some other lives on each and different areas of the body we're going to talk today. But on the breast, we can also put a breast enhancements with your own fat. But again, we will be able to have other lives speaking exclusively of how we can enhance our breast. Oh, what happened here? Oh, wait a second. Something happened here. I don't know what happened. Something happened here. Wonderful. It went off. Okay. I don't know what happened. Okay, we're back. I don't know what happened. Something took me out of the live here. of the live on Facebook, but I'm back, I guess, with you guys, with you girls and guys. Okay, so we were talking about the breast lift. So we're talking about breast lift, breast enhancement with implants, breast enhancement with fat. Again, those are the options if we want to enhance our breasts after having our baby and having enlarged breasts and then deflation of our breasts, especially with the breastfeeding. So that's our options. Another option when we're talking about mammy makeover, not talking anymore about the breast, is about the tummy. And here it's important because many of us, when we are pregnant, guess what? The baby is there inside our tummy, and the muscles that are on the front part of our abdomen starts to enlarge and to lose muscle tone. And when that happens, guess what happens? Of course, because the baby is inside and it's growing and growing and growing, pushing forward those muscles. And when the muscles are pushed forward, and then when the baby gets out, of course, the tummy deflates again, but the muscles stay up being loose. And that means that if we have lost the tone of our abdominal muscles, that means that our intestines can enlarge and push forward those muscles and give us a tummy even without having a baby. I have a funny story that actually is a true story. That when I had my baby, actually my oldest son is American. He was born here in the USA. My husband was working with a leather company here, and that's why my oldest son was born here in the USA. And I remember I was in the hospital, and before having the baby, we could choose to have like education regarding how to change the diapers and wash the baby and whatever that the hospital itself gave the mothers, and we could do that before having the baby or after having the baby. And we chose as a couple, my husband and I, to have it before having the baby. So we went to the hospital and they gave us the education regarding how to change the diapers and shower and wash the baby and blah blah blah, all of that stuff. And the funny story is that we were sitting there and they were explaining, and so the first thing we did was that each and every woman was sitting there next to their husband, and they were saying, okay, my baby's blah 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 2 days old, my baby's 1 day old, my baby's, I don't know, 5 days old, 1 week old. And then when it came to me, of course my baby was not born still, and then my husband comes to me and says, like, really 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 close to my ear, honey, all of these fat women have already had their babies, but they all have still a tummy. And I was, oh God, this guy has no idea of how I'm gonna look. Oh my God. They told me, of course, they just had their baby. That doesn't mean that the baby goes out and you just stay like before getting pregnant. But he was like in shock, you know. He was like, oh my God, all of these women with these tummies, they don't have the babies inside anymore. She's gonna be like that. I said, yes, honey, your wife is gonna be like that. Well, that's life. So why? Because of course, the uterus is huge. The baby gets out, but still the uterus starts to contract, but it takes some days. It's not immediately. And of course, the muscles are very loose, and some of them stay loose even though we try to work them out because they are overstretched. And when they are overstretched, they will never come back to how they were before. It's like, for example, have you seen those spirals that sterile toys that you throw down the stairs and they come back, like they go down and back? It's like a foil. Have you seen? They come down the stairs. And if you just go ahead and that spiral, you just go and really stretch it a lot, too much, you know what happens? It cannot come back again as a spiral. It will be extra stretched, right? And it will never come back to the way it was before. Guess what? That happens to our muscles when they are overstretched. They will never be back again as they were before. That's why many times, women after having babies, we will do as much as we can on the gym. Sit-ups, and whatever we can to really get a better abdominal muscle tone. But that just cannot be achieved. And many times we say, oh my God, we have to work harder. Or our friends will say, you have to work harder, and you can work as hard as you can. but that muscle will not be contracted as it was before. It will not have the same muscle tone. And when that happens, guess what? And we don't like that tummy, because again, many women can live with it and they're just happy with it. It's not their priority, but some others just don't look and don't feel good about it. So if you stand in front of your mirror sideways and you just relax your abdomen and you have a tummy and you don't like it, right? Maybe. And then you sit down on a straight chair and you feel there's a lot of loose skin. There's some bells ringing on your head that there's a possibility that you need a tummy tuck. That's something that many women don't like, but it's something that happens, that can be a necessity after having babies for a mommy makeover, right? So if we have loose skin and loose muscle, we need a tummy tuck. What does a tummy tuck mean? Of course, many of you already know. Tummy tuck will tighten our muscles. Of course, our abdominal muscle will be tightened, will be sutured on the midline, so we have a better abdominal muscle tone, so that if we stand on the mirror, we don't have that big tummy, because when the muscles are sutured together, the intestines are pushed back, and that's why the abdomen is reduced. And also, of course, all that excess skin will be taken out, so that when we sit down, we don't see that much skin that we don't like. But of course, that will leave us what? That will leave us a scar. A scar that sometimes is not as small as we want. We would love, many patients that have a C-section say, okay, my scar will be like a C-section. And if that's it, I accept it. But many times that does not happen, because many times we have a lot of skin. If we sit down, I say, for example, on your side bed and with the straight shoulders straight back, and you pull, that excess skin forward and down to the, like towards the pubic area, and you will see like a fold, and that fold starts to get back, like really on your side part of your hip. That means that the scar will be more or less there. So again, if you sit down, can be like on the side of your bed with a straight back, and you hold that fold of excess skin and push it towards the lower part of your abdomen, towards the pubic area, you will see a fold that is formed on the lateral aspect of your hip. As long as that fold goes, is as long as that abdominal or tummy tuck scar will go. Sometimes we don't like it, but that's the way we should go if we have that much skin. There are other options that we can go, that is a small tummy tuck, right? Or a mini tummy tuck. The mini tummy tuck is not for everybody. I wished every patient would be a candidate for a mini tummy tuck, but not everybody is. That patient that is a candidate for a mini tummy tuck, we need to choose it very well, because in the mini tummy tuck, we're gonna take less skin out, of course, so it's a smaller scar, but also we will be able to suture less the muscles. So if that woman, for example, has a lot of muscle looseness on the upper part of their belly button, the surgeon will not be able to suture that muscles well in the midline on the upper aspect of your belly button. So if we only suture the muscles on the lower aspect of my belly button, but not on my upper aspect of my belly button, guess what? I can end up with a flat tummy on the lower part of my belly button, but with a bulge on the upper part of my belly button, and that doesn't look nice. So we need to be careful to choose the right patient. That's why it's so important that you speak with your doctor, with your surgeon, with that person that you're really confident about, and with them, with the doctor and the patients together, you decide what is the best surgical plan for you. If you need to go for a full tummy tuck, or you can go for a mini tummy tuck, or you can go just for a liposuction. Liposuction will be for that patient that does not have a looseness of the muscles of the abdomen, and of course does not has loose skin. That will be the patient that just gained a little bit of weight during their pregnancy, just want to mold a little bit their body, much more shape, a little bit more waist. But again, the abdominal muscle is good, has a good tone, And of course, there's not a lot of skin. That one could go only with a liposuction. And of course, if there's a little bit of skin, we could also add another machine that is called J-plasma that can contract a little bit of that skin. Remember, today we're talking about what? Mommy makeover. So we have spoken about mommy makeover, about how we can improve our breast, how we can improve our tummy. And now the third aspect of a mommy makeover would be the what? The genital and vagina areas. Okay? Many women, of course, after having a baby, what happens? First, when you're pregnant, we have high levels of estrogen. And those high levels of estrogen can promote that my inner labia or the labia minora of my vagina, my genital area, the labia minora, they're located in my genital area, enlarge. Estrogen enlarge my labia minora. That's why many women, girls, for example, have labia minora that are okay, but when they start to have this peak of growth during adolescence, that we have a high percentage of estrogen, a high level of estrogen in our bodies, boom, the labia minora enlarge. Of course, when you're pregnant, boom, labia minora can enlarge because again, you have a high level of estrogen. And that just doesn't, we don't like it because it just doesn't look nice, right? And of course, it can hurt if you do exercise, long labia. It can also promote bad odor, so we just don't like it. And of course, in another live that we can speak more about how we can improve what we call the vagina design. That is not just the labia minora, but also working on the clitoris hood that can also enlarge when we have our babies, when we are pregnant. Another aspect very important is those women that have the babies, and after having my baby, I start to don't feel the same during sexual intercourse. That's something that many times is very intimate and we just don't want to talk about it. And many times, since we're so busy, as I started this life with my kids, so busy trying to do the best in my job, in my career, to go up that ladder in my career, that I just decide that, my sex life will be put in pause. It's not the most important thing I have right now. I have so many things to think about that the last is just sex, because I tried it after a baby and then you know what? I didn't feel the same. So right now it's just pause, and I will decide later when I reactivate it. And many times, you guess what? It stays in pause forever, to the point that kids grow up, they go to college, and then one day you wake up, you're just sleeping next to this person, this guy that you just barely know, what I'm gonna do with this guy? We don't have nothing in common. I don't enjoy sex with him. What am I gonna do with this living a life as a couple? Oh my God, And many of those women say, okay, I would love to just enjoy my sex life as I did before having my babies. Can that be done? And of course we can help you. Once we examine the patients, if you have looseness on the vagina walls, of course we can help you. And why is this common after having a baby? Well, because the baby is inside us for 9 months, right? And is gaining weight, right? Because many patients think, or many women think, that if you have a C-section, oh, my vagina will be perfect. Nothing will be damaged. Nothing will happen in my vagina. And that's not true, unfortunately. Because even though you don't have a vagina delivery, even though you have a C-section, you will still end with vagina walls that are more loose after the pregnancy. Why? Again, because the baby this is the vagina, this is the uterus, and the baby is here with its weight for 9 months, weighing more, and this weight is put on the muscles that are holding the vagina. The vagina is here. These are the muscles that hold the vagina. So the baby is weighing more. And the more weight, of course, until one day, boom, the baby is born. Boom, the weight goes away. But guess what? The muscles that were supporting that weight when the baby goes out start to what? to get loose. They are not like firm like they were, but they are loose. And that means that the vagina, it was supposed to be like that, but it now, the muscles that hold it are loose. It doesn't look anymore like that, it looks like that. And that has a big impact on what I feel during my sexual relationship, during my sexual intercourse. Why? Because when the penis gets in my vagina, what gives me sexual gratification? What gives me sexual gratification is that the penis is pushed to the anterior wall of my vagina, and friction on the anterior wall of the vagina with this penis gives me what? Sexual gratification. But if my vagina is not tight, is loose, I can push as hard as I can. But guess what? That penis will not give me enough friction on my anterior vaginal wall. And of course, what happens? I feel less. I feel less sexual gratification. That's why many of us just put our sex life in pause, because we just don't feel the same. And it stays in pause. So the third aspect of the mommy makeover will be a vagina tightening procedure that actually I don't like to call it vagina tightening. I think it's the wrong approach. Why? Again, that can be another life to explain you all about it. But I can talk a little bit today about why it's the wrong approach to think only in vagina tightening. If you just research my CV, you will see that I'm a pioneer in vagina rejuvenation procedures all over the world. And it's very important for me when I educate my peers, my colleagues, my plastic surgeons, colleagues, to tell them that the important part here when we're talking about vagina tightening is not just tightening the entrance. That's the wrong approach. If I tighten the entrance, what will happen to a woman that after having a baby has a loose vagina and it cannot have the same sexual gratification because the penis is not giving friction on the anterior vaginal wall? If I only tighten the entrance, will that improve? No. The important part here is that not just the entrance. The entrance will just give friction to the penis, so the man will feel more. But what about me? I had the procedure done. I deserve to feel more. Sexual gratification, of course. So that's why it's so important that we just don't tighten the entrance. We need what? We need we need to recreate power on my vagina muscles so that I have more power to really push harder that penis. And that's the whole purpose of a vagina rejuvenation procedure, not tightening the entrance of the vagina. Well, I guess that was what I had to say to all of you today. A little bit of what is a mommy makeover that includes breast, includes the tummy, and includes, of course, the vagina and the genitalia, like labia, like large labia minora. Many women just also want, when we do the abdomen, to have a complement on reshaping the body or also putting fat on the buttock to get a better shape. Of course, that can be done also with the mommy makeover. That many times is also accompanied, and I say it comes also together with what I just told at the beginning of this life. That woman, when they start to look at the mirror and say, oh my God, now I'm starting to have these wrinkles that I didn't have before, and all of these things, aging signs in my face that I don't like. That's why the non-surgical facial procedures go very well next to the mommy makeover aesthetic plastic surgery procedures. So again, I have so much light on top of me that I cannot even read what you're saying there. I really can't, but I will try to do my best. No, it's very difficult for me to read any answers. Let's see if I take these out and I can have a little bit. No, it's very difficult because I've had all of this time. So I think I'm gonna pause today, this live. I wish now when I'm at home with all my equipment, because right now I just custom made a little bit with some books and everything to have the live today with all of you, girls and boys, or women and men. But I hope I was of any help for any of you towards what we can be done after having a baby, what we called a mommy makeover. I'm very happy to have these lives in English that we started because of you, because you wanted those lives in English. So make sure and write in our Instagram, in our Facebook. What do you want me to talk about in the next live? And I will be just there in the next English live to answer any of those questions. Thank you very much for being with me today, and I hope to see you again soon in another live in English. Or if not, remember, we have them every week in Spanish and once a month in English. Thank you very much. Enjoy the rest of your day or your night. And again, hope to see you soon again. Bye-bye. Let's see, what is this? And here. Martín.